So we're talking today about Oldham Community Champions funding, and it's a phase 2 funding. So to kick that off, really, I wanted to show you visually some of the amazing stuff that groups and organisations in Oldham have been doing with the Community Champions funding in phase 1. So there's a really good snapshot there of some of the projects, some of the participants, and some of the, to give you a sense of a flavour really around what Community Champions is all about. So in phase 1, there we go. So groups, community, voluntary, faith groups have been working across Oldham on phase 1 since March last year. Hundreds of volunteers from over 70 groups and organisations have been delivering Community Champions COVID community engagement work across the year. Some of the things that they've been doing have been things like training community leaders, faith leaders, holding community conversations about COVID, about how to keep yourself, your friends, your family, your community safe from COVID. And then they've also been involved in some of the COVID response work, so hosting pop-up testing sites in the venues, or vaccination clinics in the venues, supporting the running of those vaccination clinics or the testing sites, helping the council with their door-to-door engagement, literally kind of going into areas where COVID rates are really high, knocking on doors and checking out that residents are well, are safe if they need anything, but also sharing some really important messages around COVID. Others have been making videos, sharing their experiences of COVID and living with COVID with their communities. And all of them have been sharing some of the key COVID messages with their communities that are being shared by Oldham NHS or Oldham Council. So that's some of the stuff that those groups and organisations have been doing through phase 1. So why have we got phase 2? So the impact that the Community Champions work has had has been really phenomenal in Oldham since March. So like the impact that it's had on the vaccination uptake across some of our communities has been incredible. And feedback from not just the community partners that are delivering this work, but actually from the people in their communities, actually hearing and understand, like having someone to have a community conversation with, particularly when the guidance around COVID changes, particularly when the information changes around vaccination or around testing. There's been over 200 changes in COVID guidance and regulations in the last year. And actually community members are telling us that it's so much easier to understand what those changes are and what they mean to people if they're able to have a conversation with somebody they trust from their community. So phase 2 of the funding, when we launched this back in the end of November, really was around kind of how can we build on the strength of those community conversations and those relationships, and help people recover from and those communities through the next sort of what we thought this next 6 months were going to look like in terms of that recovery and living with COVID. Fast forward another couple of weeks and we're in mid-December, and the Omicron variant has landed in the UK. And that, then changes some of the focus slightly of this work, in that, those kind of key COVID messages and those COVID conversations are so important, whilst we've got infection rates that are the highest really they've ever been in Oldham and indeed nationally. So the aims for phase 2 of the funding then were all around building on that work from phase 1. So continuing to engage with some of those communities that in Oldham that are most at risk from coronavirus. And in phase 1, that was a real focus on South Asian communities, our Roma communities, our African communities, and our communities of people with learning disabilities and autism. In phase 2, we wanted to extend that work into some other communities of focus and communities of place. So, thinking about young people, thinking about people who live with complex disadvantage in their lives, and also thinking about people who live in the communities in Oldham that have lower vaccine uptake and have higher ongoing rates of transmission. So that's the focus really for phase 2. So building on and continuing with some of the work through phase 1, but actually extending the scope of that. So really we're thinking about those community conversations across Oldham. So the funding can be used really by the group or organisation to support their capacity to deliver community engagement type work. It can be used in any way that the group or organisation feels they need it to support their capacity to do this. But it really must be for community benefit, and it must be in line with your organisation or your group's charitable objectives. This funding is government funding, so it comes directly from national government into Oldham Council, and then through ourselves to the voluntary sector. And therefore, there's some really strict stipulations, because it is national government funding, around when it needs to be, the activity needs to be delivered by, and when it needs to be spent by. And currently, and I say currently because this could change, it has on another couple of grants, but currently it's that this is for activity, really some intense activity over the next 3 months. So spent up and delivered by the end of March. And it's absolutely about the stuff I've been talking about. It's about giving specific support and community engagement with the people that your group or organisation in Oldham are in touch with. It's about you using your engagement channels, so your Facebook pages or your WhatsApp groups, to help share the messages and help to have those COVID conversations. As part of the work, it's really important that you and your staff and your volunteers feel really confident in having kind of COVID conversations and have the up-to-date facts and information. And there's a whole range of kind of training and resources that we've got in place to help you feel really confident that you in having those conversations. It's about you being more involved in supporting some of the working alongside and with some of the other community champions, supporting the local testing sites, supporting the local vaccination clinics, and supporting and working alongside ourselves at Action Together and Oldham Council and the CCG to really communicate some of those really key messages. So the funding is absolutely for voluntary, community, faith or social enterprise organisations. So basically it's absolutely about not-for-profit, voluntary, community, faith, social enterprise organisations. There's 2 levels of grants available. So there's grants of up to £10,000 if you are a community anchor organisation. Now in the guidance notes, there's a definition of a community anchor organisation, but generally it's a community organisation that is rooted in a place or rooted within a community of identity, often but not always has a building where activities are delivered from, but has a really significant reach into the communities that you work with. If you've been delivering phase 1 work as a community anchor organisation, then can absolutely apply for that grant to extend your work to the end of this financial year. If you were a community anchor organisation and you haven't been involved so far and you'd like to be, then absolutely, you can apply. And if you're not sure whether you would be classed as a community anchor organisation or not, then, have a conversation with us and we can help you work that through. So that's the first level of grant. The next level of grant is £5,000 grants. And these are for groups and organisations that wouldn't be classed as a community anchor organisation, but are absolutely rooted within Oldham's communities, rooted in communities either of South Asian, Roma, African, or people with learning disabilities and autism, or rooted with young people, rooted and working with people who experience complex disadvantage in their life, or the rest of the communities in Oldham. What we're seeing through the Omicron variant is that we've got pretty much every community in Oldham has far increased transmission rates around Omicron. So basically, if you are working in Oldham, if you are rooted in a community in Oldham, whether that's a community of place, a geographical place, or a community of identity, then this is, you know, absolutely something that we want you to come and get involved in and receive some funding and investment to help you do that. As with all our grant giving and investments, we ask that you are a member of Action Together. Membership is free. It's really easy to complete. And what that helps you to do really is then connect into all the other support that we deliver as a local infrastructure organisation. But actually, by becoming a member, it also means that you can have a say about what we do and how we do it, which can be really helpful as well. And the last thing that we're asking on this fund is that you are formally constituted as a voluntary community or faith organisation. So this isn't something for those more informal or social action groups. Finally, alongside this funding, there is an ideas fund, so some additional sort of micro grants for up to £1,000 for groups that are delivering community champions work who need a little bit of extra funding to put on a particular event or see a particular idea through that they hadn't thought about when they first put their application in. Okay, so if you are successful, one of the really important things about the community champions work is not just about giving out messages to community members and having those conversations. It's about helping the Oldham system, so the NHS in Oldham, the council in Oldham, the CCG in Oldham. It's about helping them to understand the insight from within communities, so understand some of the reasons why some community members are hesitant around taking the vaccine, insight around why people find it more difficult than others to isolate if they do receive a positive test. So that community insight is incredibly important, because what it does is it helps us working in Oldham around the COVID response to make sure that the response meets the needs of those communities. And it really helps us to build out the inequality that could be faced by some communities. And there's loads and loads of examples of how working with our phase one, through our phase one community champions partners, we've had significant changes in the way things are done in Oldham to make sure that we're tackling some of those inequalities head on. And to help do that, we've got an insight tracker, a community insight tracker in place, which is a really simple way for you to capture and tell us about anything that's come up in a conversation that you've had or a session that you've run. And then we look at that information on a kind of a bi-weekly basis, really, and make sure that it's informing, anything in there is informing the response. The other thing that is critical to this community champions work as well is the network. So those 70 odd organisations I was telling you about before, who are community champions in phase one, we get together every month on a Zoom call and sort of share our experiences. We can talk through any updates in kind of regulation or guidance, but actually just kind of, it's more about peer support. It's more about collaboration and kind of how we can work together to help keep Oldham's communities safe through the pandemic. Okay, so here's just a little slide it's got the links in. So when I send this out, you'll see there's a little link to the Oldham's Voice webpage there, which is where we capture the insight through the conversations that you're having. And then there's also a resource library available for community champions, well, for anybody really. You've got access to that. So there's fact sheets, there's posters and leaflets, there's video clips, there's information, and when when there's any changes to the regulation, which let's face it is quite often, there'll be new material posted up there to help you to explain what some of those changes mean. So for example, really recently there was a change to the isolation period from 10 days to 7 days. There has been a change around LFT testing versus PCR testing, you know, and all these changes are really confusing for people, and actually really confusing for the people who are trying to help people through it. So we're doing our level best really to get the information updated and the messages sent and shared, so that to support you to have those conversations. Another way that we stay in touch is through our Community Champions WhatsApp group. This is actually my favourite WhatsApp group on my phone. This is a really good space where people are sharing kind of every day, sharing stuff that they're doing, asking questions of each other, getting peer support, sharing some of that insight as well that we can respond to really, really quickly. So again, a really good little resource for you in terms of supporting you to do the work. Okay, over to the application process then. So all of the application information is on our Action Together website. There's the link to the specific web page, but you'll find it in the funding section of our website. There's one application form. So if you want to apply for an Anchor Fund, the 10,000 pot, or the Champion Fund, the 5,000 pot, there's one application form for you to complete and just indicate on that application form which one you want. There's some really, well, I think they're really clear, but there's some clear guidance notes there to help you with that application form. And we've also put a little flow chart in place as well. So if you were thinking about making an application, you can have a little look through the flow chart to help you decide if you want to make an application, but also which application you want to make. So just reiterating, then this grant funding and the activity needs to be delivered and spent by the end of March. That says 2021, it should say 2022. I've not got my head around the fact that we're in a new year yet, clearly. And there isn't a deadline for applications because it's about just us trying to support people who are either already having these conversations or want to do this community engagement work. So we're accepting applications on a rolling basis, and we're doing everything we can to streamline the processes around kind of the decision making, and getting the information from you and then the money back out to you. All eligible applications are considered by representatives of the Oldham Community Champions steering group. That's a group of people who work across the council, the CCG, primary care, public health, ourselves, some of the phase 1 community champions, anchor organisations are there as well. So all applications are considered by the steering group, who then make the decisions. And we aim to let you know the outcome within 2 days of the steering group meetings. To be fair, we kind of do it the same day because we're really mindful around kind of how short term this funding is available for. Okay, so there are, as ever, some expectations, some of the things that, you know, if you're coming alongside and working as a community champion and receiving some of this investment, that there's some things that are expected of you, and we want to be really clear around that kind of upfront. So for people who are applying for anchor funding, there's an expectation around you kind of facilitating some work with other community champions in your area, and attending the community champions steering group. So being a part of that kind of steering group that is leading the direction of this community engagement work. There's also an expectation that you'll link into some of the other community networks, and community explorers is a really key one. So the community explorers is our grassroots place-based network in Oldham. They meet monthly in each of the communities in Oldham. And a really important expectation is around you gathering insight from your community. Similar for Champions funding, so this is for the smaller pot, the 5,000 pot, where there's an expectation that you'll participate in a community, in an action group. So if you are, say, applying to do some community engagement work with young people, there's an expectation that you'll connect into an action group who are with others who are doing that work, and connect some of that work up and collaborate on it. And obviously the expectation around sharing the insights is so important, that we understand what it's like for residents and the people that you're in touch with. Obviously, you wouldn't expect there not to be this expectation, but it's really important that in your community engagement work that you're doing, that you're complying with all the public health guidance and the government directives. I was going to make a political point, but I'm going to really try not to, given the current news. But yeah, just really important that you're following all the coronavirus advice for community groups during this time. And the other thing just to say is that if you've been working with us as a phase 1 community champion, then we do require you to complete your monitoring and your impact information before we can do any more grant investment to you. I don't think that applies to anyone here. Okay, so apologies that was a little bit dry. I'm going to stop sharing now. Okay, so just open up. I don't think there are any other questions in the chat. So just open up if anything that's sprung to mind for anybody.